Welcome back to On the Beat, everyone. I'm your host, Rachel Hurt, and today in the studio we have Amanda Fondren and Heather Holloway of Omnis Health Clinic, and today we're going to be talking about these ladies about obstructive sleep apnea. That's a mouthful, literally. What is obstructive sleep apnea?
Well, it's actually where your soft palate collapses and it causes an obstruction in your airway.
Is it? So years ago, I worked for an orthodontist, and we had an x-ray machine where we could look and measure people's airways, and they would get very, very thin at certain points from the soft palate. How is that prevented or detected?
Well, prevented is like smoking contributes, alcohol consumption contributes. GERD will contribute to some of that irritation, which causes swelling. But detected, you have to do a sleep study for sleep apnea. It can be done in office, and now it can even actually be done at home. They actually measure your brain, your respirations, your heart rate, your eye and leg movements to know if you're actually sleeping well. And the actual test is going to show you how many times you quit breathing, if you quit breathing, or if you're struggling to breathe.
Really? Okay, well, so say I haven't had the test done yet, and I am not getting a good night's sleep, waking up restless, tired.
Right.
What are some symptoms that would give me the cues that maybe a sleep study was something I needed to go and do?
Well, if you have a partner or you sleep next to someone, if they hear you snoring is one of the biggest clues. Loud snoring, because once it collapses, it kind of is muffled, and so snoring causes that. You also will see fatigue, severe fatigue during the day. You will see kind of a memory loss, like you're not really with it, you will feel. You will have loss of a sexual drive.
Okay.
You will see some depression. You see lots of things that you wouldn't think from a good night's sleep would come, but over a period of time, if you don't have a good night's sleep, these things start really coming down on you.
Wow.
And then it's been proven that you've seen type 2 diabetes, strokes, heart diseases with uncontrolled sleep apnea.
Really? Well, how do we treat sleep apnea? What do we do?
Okay, well, the gold standard is a CPAP. A CPAP is actually continuous oxygen that is forced through your nose. So at that point, even though your throat is a little bit shut, it's forcing it down.
I see.
So that is the gold standard.
Okay.
The problem is a lot of people can't tolerate it.
Right.
So you have to kind of weigh. You can lose weight. Weight sometimes will help. Side sleeping will help. Don't drink alcohol a couple hours before bed will help, and not smoking.
Well, I'm sure that we can all guess, but I'm going to ask you, in your professional opinion, why is it so important that this be controlled?
Because of the things that it can cause, the stroke, the heart disease, and it's been proven to actually shorten the lifespan.
Really?
That's
wow.
what's most
That's
important.
A scary thought. That's a very, very scary. Well, thank you so much for sharing all
welcome.
that. Obviously, this is something that we all need to be aware of, and if you want more information about treatment options and to see if you're a candidate for those treatment options, please go visit Amanda and Heather at Omnis. All the information is on the screen. Give them a call, shoot them an email. They'll be happy to help you, and we'll see you after this short break.